talk about is how do you know when adolescent moodiness, such as depression or passing bouts of anger, are somehow something that are absolutely normal kinds of behavior. That's pretty much what an adolescent does for a living. And when you should be concerned that you're dealing with something that requires professional help. So let me take a few minutes to talk about this. First of all, it's totally normal for an adolescent or young adult to go back and forth between periodic intermittent moodiness and regular kind of mood. If a sad mood or an irritable mood is dominating, so that more times than not your interactions with your adolescent are marked by depression and by anger, or if you notice that in terms of their interaction with friends, you see similar kinds of signs of moodiness, then you start to think that maybe this is something that is signs of a true underlying kind of depression. For example, we know that there's something typical about adolescent depression. It's not what we see in adult depression. Unlike adults, sometimes adolescent depression could present as boredom, or it might present as irritability and oppositional behavior. Again, this sounds like regular adolescence, but when it starts to dominate, and especially when it's interfering with functioning, at that point you need to think that maybe you're dealing with a need for a consultation with a neighborhood therapist. It's interesting. A lot of recent clinical research has shown that the earlier you catch a depression, the better it is in terms of long-term prognosis. Ongoing significant levels of depression that are untreated can literally change the adolescent brain and make your child more at risk for recurring bouts of depression later in their life. Again, please don't see this as a need to run to a therapist when dealing with the typical intermittent moodiness of a teenager. But when you see really significant changes in body, mood, or behavior that seems to be dominating more often than not, then what you need to do is consider going to a therapist. The second issue I wanted to talk about is who is a good candidate for therapy and what are the benefits of therapy versus going to a good mentor. In terms of candidates for therapy, the research shows surprisingly that actually if you have an adolescent who's in the least bit open to going for help and they're showing problems in any part of their behavior that is leading to significant impairment of their ability to enjoy life and their ability to function in school or function on a job or function socially or function at home, and that's really what's dominating, then that's a pretty good indication for somebody to have to go for therapy. But it's equally important to understand that if a child is resisting and absolutely refusing to go, and they're not engaging in life-threatening behavior, you should probably consult with your neighborhood therapist or somebody who comes highly recommended to see what he or she recommends about the next step. It's rarely helpful to drag somebody yelling and screaming to a therapist unless you carefully plan how to do it. Just think about how you would handle it if somebody forced you to go for help when you didn't want to go. It's like the Boy Scout crossing the lady to the other side of the street when she wants to stay on this side. In terms of connections with the mentor, the research on mentoring shows that it could be incredibly, incredibly helpful, but often synergistically. Ideally, if you have a serious problem, there's a role for a mentor who could stand by your child's side and be there for him or her, and a clear role for a therapist as well. One of the most respected books on the psychology of mentoring, written by a psychologist at Harvard who spent her career looking at what's effective about mentoring, was titled Stand By Me, because in essence that's what a mentor does. It's not the content of what a mentor does, but it's somebody who's just there for your child to help your child sort of feel valued and feel like there's a significant adult outside of their family who's standing at their side. What a therapist does is very different. What a therapist does is to help, for example, with mood regulation, help with serious issues in terms of family or social conflict, help with areas where the child is helped to either think in a more accurate way, handle emotions more effectively, and in general systematically try to work on issues that are hampering their ability to enjoy life the way one would want one's teenager to enjoy life. Again, the bottom line here is there's an important role for therapists, important role for mentor, and ideally you want the two to work together if the professional you're consulting with feels that both are necessary. Thank you.